Thank you for joining us, everybody. And today I have with me Helen Chapman, who's my clinical lead at the Cosmetic Skin Clinic, and Karolina Jendras, who's one of the senior nurse practitioners, both of whom have the accolade of being Ultherapy trainers, which we'll talk about in a moment. But we're going to be talking about generally about game-changing treatments for the 21st century. And there have been a few very interesting treatments that a lot of our patients ask about, don't know enough about, and we hopefully will be able to just give you a flavour of what these treatments do, and also dispel some of the myths. And some of them carry along with them a lot of myths. So I'm going to kick off straight away and talk about Ultherapy. As I say, the two practitioners that are sitting with me today discussing it are UK trainers, so they know everything there is about the technology. So Helen, just give us a little sort of overview of what Ultherapy does and why patients, come in and want to know more about it.
Okay, so I believe Ultherapy is the best skin tightening and skin lifting treatment available on the market at the moment. It basically delivers heat energy, predominantly for the face. It delivers heat energy to stimulate our collagen. As we know, collagen is the scaffolding in our skin. So the idea is to boost that collagen and cause some lifting and tightening.
Right, so it's a skin lifter.
Yeah.
And where do you use it? So when you use it, do patients want it on their face? What areas are people most concerned with?
It's majority of the face, and particularly along jaw lines and on the neck area, and where we get some laxity kind of under this area as women. But you can also use it in the upper face as well, just to kind of elevate the brow slightly and just tighten and firm the skin. So all over really, all full face.
Right.
And
so
also,
it's very versatile.
Absolutely, and also on the décolletage and arms. So it's also approved for body areas as well.
Yeah, so it sounds really versatile. So Karolina, because as everybody knows, Zoom now is the way we all live and talk, and so it can be a little bit disjointed because normally when we all talk together in a room, it will flow. But just give us a little bit of not too much, but just for people to understand, because it all sounds a little bit too good to be true. If you use a device that's non-surgical that gives lift, can you tell us give us an idea of how it works? Helen was alluding to the heat, but can you explain what we do and how it works?
Of course. This technology uses ultrasound, which is basically a heat that's delivered to very deep layers of our skin. And actually, Ultherapy reaches the muscle, same muscle that a surgeon normally works on. And as a result, this heat helps with shrinkage and contracture of the muscle, creating a lovely lift and tightening effect.
Yeah, so that's really nicely put. So that's why it works really, really well. And also we know that some patients as well that are sourcing a non-surgical solution sometimes get a little bit confused about what's out there, because we all know, don't we, we've used other technologies in the past and that some of them have been very good and some of them not so good. But certainly in our view, Ultherapy is the gold standard because it is very precise, because the ultrasound allows you guys to visualize directly where to hit the sweet spot, doesn't it?
Absolutely.
Yeah.
Absolutely.
So I think that's what sets it apart from other things, because people say, is it HIFU, which is high intensity focused ultrasound? Well, it is, but it is with a twist, because actually it's got direct visualization. So we actually can see what we're treating, which makes it a predictable outcome. So can I just again go on to when you guys integrate this technology, because it has been a game changer in the clinic. I know that because I'm in the clinic all the time and you guys treat all the time. What do you find? Do you use it as a standalone treatment, or do you use it in combination? So we don't all talk over each other. Helen, I'm going to bounce this one to you and then I'll come on to Karolina.
No, we often combine this with other treatments, such as the injectables or other technology treatments that we've got here. We've got quite a good selection. So it depends, every patient sort of assessed differently, and we'll set up a treatment plan according to their needs. So, but Ultherapy is great for anyone, really, anybody between the ages of 30 and 60, even above. So who just needs a little bit of collagen boosting. So.
Yeah, so it's, again, we're talking about this huge span of people that it can treat, and again, we're going back to the versatility of it. And Karolina, in your experience with patients you treat, what would you say?
I love Ultherapy, and I love combining it with other treatments, of course. But what I always say, with things like injectables, we often can get a lovely wow effect quickly. But what is very important and something we often neglect is what do you do to deeply regenerate your skin from within? And Ultherapy is a game changer and an absolute gold standard. However, I always say little tweak with other treatments, technologies, and products will work beautiful in combination.
Yeah, just
I
enough,
also
but
think,
not too much. And that's the point, isn't
yeah,
it?
I also
And I
think
think,
it's so popular because it carries no downtime with it. So it's very safe and people can go literally back to work or, you know, there's no downtime with it. So that's another great thing about it, why it's so
yeah.
popular.
Yeah, and I think that is what patients want. They want, you know, nowadays, really in a way, because non-surgical has progressed so much, the patient expectation is they want almost a surgical outcome, don't they? But with a non-surgical solution. And a non-surgical solution is a given that people would expect very little to no downtime. So that is a big thing. And I think that is really important to say. And what you touched on earlier, Helen, is one thing I just want to develop a little bit more. Because you were talking about the span of ages that we can treat. And of course, you know, nowadays there's a lot of focus on prevention, you know, so we're not having to just sort of stop, you know, intervene at somebody when somebody's 50 or 60 and sort a problem out there. A lot of discussion now is about preventative treatments. So just to touch on this very briefly, do you find that you're getting more people, both of you again, that are coming through for prevention and sort of investing and in the collagen bank, sort of boosting that collagen? So Helen, again, I'll bounce that to you.
Absolutely. I think people are definitely coming in and thinking more about the preventative side of aging. So Ultherapy is great for that as well. So people are thinking about that in their 30s and even early 40s. So it's getting behind that concept, like you said, of collagen banking. Because as we know, every year our collagen diminishes and the idea is to boost that back up.
Yeah. Yeah, it's very clever. And Karolina, do you see quite a few patients now requesting prevention or not?
Absolutely. I think it's a way forward. We've got very savvy, educated young patients who want to prevent and maintain their skin's health. However, a very important thing is that quite a few of my ladies actually are older and have had things like facelift surgery and use it Ultherapy to maintain the results of it. They use it as an investment in actually maintaining this collagen and their skin in a tip-top condition.
Yeah, you said, both of you, you said two things that really made me think. The first thing was exactly what we know. It can be used. It's what's so versatile about it. Again, we keep using that word, but it's true. So it can be used on its own preventatively. It can be used prior to facelifting surgery when a patient either isn't ready for it or for surgery or doesn't ever want surgery. But it can also be used after surgery to maintain the effects of a facelift or eyelid surgery even. You know, people don't want a full face treatment, but they've had eyelid surgery and they just want to maintain that look. So that's really important. And second is what you said, ladies. But what we're all seeing, aren't we, is more men as well.
Absolutely.
Coming into clinic, and they're actually, because there's no downtime and because there's no telltale signs of Ultherapy, they actually quite like this treatment, don't they?
They do. And quite a few patients' husbands have come through the door, and this was their first introduction into a world of anti-aging.
Yeah, no, that's really good. So let's get on to myths and myth busting, just again, very briefly, because what we're trying to do is give just a little snapshot so people sort of understand. And the only thing that perhaps, as we all know, again, we know, but patients may not know, or prospective patients may not know. Ultherapy's been in the market a while, hasn't it? It's been in the market quite a good few years. It is FDA cleared, which means it is proven to work. It's proven to be effective. It's proven to be safe. But it's been sort of tweaked over time, which again, I'll let one of you discuss. But discomfort. So everybody wants a great result, but they don't want any discomfort at all either. Or they're prepared to put up with a bit, but they're slightly frightened about discomfort. So again, I'm going to bounce this over to you guys. What, in your experience, do you find patients say back to you when they've had an Ultherapy treatment, and how do we make their journey comfortable? So Helen, what's your experience?
My experience is that they always say it's not painful as such. It can be a little bit uncomfortable in certain places. We get what we call hotspots because it's a heat treatment. But generally now, because we use a great cocktail of medications prior to the treatment and potentially numbing cream as well, they find the treatment really, really comfortable. And people are always quite surprised. So when we do a few shots, they'll say, oh, wow, I imagined it to be a lot worse than that. So,
yeah,
pain scores are very low on this treatment. People find it a little bit prickly in places, that kind of thing, but not painful.
Yeah. And Karolina, would you say that? Do you find patients report that?
Absolutely, I agree. The treatment is uncomfortable in places, but it's very, very manageable. Most patients are actually very pleasantly surprised on how comfortable it was. And then they come back every year or two, so we know that it couldn't be that uncomfortable.
Yeah, that's a good point. Nobody would ever come back again if it was that uncomfortable. But I think it is important to talk about it, because in the past, and we know that the technology has been refined, improved, software has been improved over time to make the treatment much more comfortable. Because in the past, it did, we can't get away from it. It did have a reputation of being very uncomfortable. And there was an element of, well, if it's not uncomfortable, it can't work. So it has to be uncomfortable in order for it to work. But that's not true. And I think all of us have had Ultherapy. I've had Ultherapy. You guys have had Ultherapy too. We know how it feels. And I think it's honest and fair to say what Helen was saying. There are a few places that you think, oh yeah, I can feel that more. But most of the treatment is actually completely tolerable, isn't it? So, and I think we found other ways, as you said, medication, cream, to make that even more so.
I also think when
what did you think there was any other myths with Ultherapy that you wanted to, is there anything that you think, patients come in with these preconceived ideas or misconceptions about the treatment?
And I always want to reassure my patients, because of the visualization, this treatment is so precise and targeted that we know as experts and practitioners at which plane we work at, making it very, very safe.
When we talk about, patients sometimes feel, because again they get on the internet and they look at certain reports, the beauty of Ultherapy is exactly what you say. It's precision. If you can avoid structures, you can just target the thing you need to target, and that's it. And I think that is what makes it very safe, and certainly, but in the past, yes, that has been something that patients will discuss, isn't it, or certainly raise as a query. But I think once you've had a treatment and see that we can treat all kinds of faces, we know that we can treat all kinds of skin types. We know it's not like a laser where we can only treat certain skin types and we're worried about hyperpigmentation. So that's important to say. Yeah. That with lasers, Helen, we consider certain skin types, but with Ultherapy we don't have to, do we?
No, not at all. You can treat any skin type. And even people have concerns about skin conditions such as eczema, psoriasis. They can all be treated with Ultherapy, because at the end of the day, we're putting the heat deep, like we said, onto muscle. We're bypassing fat. We're bypassing, other things. So it's safe for anybody.
Yeah, that's a good point, Helen.
Which is a big win. It's a very, very big win. And the fact that it keeps everybody, nowadays, and should be forever, everybody looks natural with it. It's a very natural endpoint. You can't over tighten. One of the myths, again, that I've had asked me, I don't know whether you've ever had it asked for yourselves, is, can it over tighten? Well, no, it can't do that. All it's doing is giving that nice, soft, regenerative lift all over, sort of turning the clock back a few years. It can't over tighten. So can I just go on to talking about other treatments now, because we talked about Ultherapy, and people who want to know more can obviously give us a call and find out more and have a consultation with one of you guys. As UK trainers, there's nothing you haven't seen and there's nothing you haven't done with it. So that's worth discussing or saying to people. But let's just go on to other game-changing treatments that potentially we've seen recently over the last few years. And if I had to ask you guys what has been a big game changer in clinic for you, what would you say? So again, I'm going to do it in order just purely because it stops all talking over each other. Helen, what would you say is a game changing treatment? I have to explain how it works, but just what do you think has been the game changer for you?
I think Profilo has been you know, extremely popular and a real game-changing treatment in this clinic and for myself with my patients. Again, another very safe injectable treatment of hyaluronic acid gel, and as we know, that's the skin's natural moisturizer. So it's a great treatment that you can have in conjunction with other treatments again.
Yeah, and it's not, just to clarify for people, it's not a volumizer, is it?
No, not at all. It's more to hydrate and cause that kind of natural plumping that we want in the skin without causing any volume.
Yeah, which again, if it's, you know, a lot of people are looking for this. They're looking for other ways of treating without volumizing. We all know that significant volume loss often does need volumizing, but a lot of people don't need it. They just need a lift and a tighten. We say something like Ultherapy, and some really nice sort of hydration and ping back to the skin that the Profilo gives. And also, what areas of the body can you treat the body as well, or is it just face?
Actually, we get some fantastic results on the neck as well, because the neck is a big problem area for men and women. So with Profilo, you can treat obviously the face and the neck area, even the décolletage, and on the upper arms as well. So
yeah, arms
it's
are
very
a good
versatile.
one, actually. Yeah, arms, we do quite a lot of that, don't we? Because we do our body contouring, and I think it takes quite a bit of Profilo to get the result, but the actual arms can really look much better with, you know, and that laxity that comes through, particularly in perimenopausal and menopausal women. And Karolina, what for you would be a game changer? I know you like Profilo or Profilo, whichever way you want to say it, but I know you also got another favourite, as Helen does, but what's your favourite?
There is a couple. It's so hard to choose. I like combining Ultherapy with other technologies such as Tixel. And this is particularly good for the texture and sun damage, but also very fine lines. And it works beautifully on the upper and lower eyelids, as we can use it very safely all over the eye area. And then a little bit of Volax in the jawline to define our features post-Ultherapy. Does a little treat too.
Oh, so you're talking there about an injectable filler, aren't you, there?
Yes.
So you're talking about doing maybe some jawline treatment to just give that added oomph where it's needed, in people that need it, in people that require it.
And I think when one invests in Ultherapy, it's good to finish the work where it's needed to define and lift even more if necessary.
Yeah, I think what we're talking about here more, isn't it, really, is talking about where perhaps years and years ago we would just use maybe one, maybe two things. I think a lot of people over a period of time are not going crazy. They're not looking weird or overdone. In fact, if anything, the opposite is the case. By just integrating light sort of treatments that are regenerative, supportive, we're actually getting much more sophisticated results, and they're just imperceptible. So they don't look like anything's really been done. It just makes the skin look really fabulous. The face and neck or whatever's been treated look really rejuvenated and fresh. And this is where the sophistication, I suppose, of non-surgical medicine has come through over the last few years. We're just being quite clever with just using all these things, as I said earlier, just enough, but not too much, just to get the right result.
And I think we're able to address every skin layer down to the muscle right now, from skin surface to deeper layers for the deeper regeneration. So I think we're very lucky to have such a array of amazing treatments to choose from.
Yeah, it's a big menu, isn't it? So I think that this was really interesting. I think that the messaging here is there's some great technologies, there's some great new treatments, and there's some great game changers. Is there anything else? Before I sort of wrap up, is there anything else that you feel has really changed the way you work over the last few years?
I just would like to say that I'm missing my patients and I can't wait to see you all.
I know, it's been a long time, and I know that it's been quite a challenge, hasn't it, for everybody? And I think we all can't wait to see them in both sites. And I think now we're pretty much there with when we know when we're all going to come back. Yes. So not long now, everyone, but this was just meant to be a taster for people, just a little bit of a background, and then allows people, if they're interested, to come back and see us with renewed interest in certain treatments. So thank you very much, guys. It's great to speak to you.
Thank you.
And see you all in clinic very soon.
Yes,
See
definitely.
you soon.
Take
Bye.
care.
Bye-bye.
Take care.
Bye.